You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. We're talking about dental implants today. With us, we have an expert on the topic, Dr. Ramsey. Dr. Ramsey, welcome to the program.
Thank you for having me.
Now, we've had you on the program before talking about smile makeovers, and I guess you have a big reputation for veneers. But dental implants.
Yes.
You have a big denture crowd. People, you say no more dentures.
I say no more dentures because it's the 21st century, and if you're still stuck in dentures or wearing something that doesn't fit well, or you're uncomfortable with, or it's falling out, or you wake up in the middle of the night and they're somewhere else in the room on the bed under the covers. I mean, those days could be over, and a lot of people just don't realize that.
Now, you teach other doctors the science, I guess, and the art of dental implants.
Yes.
Is that right?
Because it is
all
an
over
art and a science, absolutely. The concept of dental implants is such a major art and such a major science. Quite frankly, placing a dental implant often, for most people, is not that difficult. But placing the dental implant at the right position, at the right angle, so that the teeth that are going to go on it look right, that's the art.
So with denture wearers, I mean, are there a lot of them in your area?
Wow, yeah.
Like, would you say 1,000, thousands within an hour of your practice?
Thousands. There's thousands of people that are listening to us right now that are within our area that are denture wearers. And unfortunately, a lot of those denture wearers are not happy denture wearers. It's like walking around with a rock in your shoe. You can do it, you just don't love it.
Okay, so so you say with as little as 2 implants, 2 dental implants, you give them a full arch of teeth?
Right.
That are secure in
Absolutely.
there?
In fact, if you talk about services we provide, that's probably one of the main services we provide. You can get somebody who can come in and they can tolerate an upper denture because the palate of their mouth allows that denture to stay in, but a lower denture can be so difficult for so many people. And one of the best services we provide people is they come in and say, listen, I think I need a new denture, but truth be told, it's not that they need a new one. They just need something to stabilize the lower, because the lower is the hardest thing to wear. So 2 dental implants, snaps in. I got to tell you, those are some of the happiest patients that I see at the end. They're like, I didn't know this was possible. This thing is as solid as a rock, and they love it.
How old can you be to get dental implants?
That's the great thing. I mean, there is no age limit. If you've got dentures and you're unhappy with the way they fit, or you're just not able to eat the foods you want and do the things you want to be able to do, then you need to know what's possible, because that's the biggest problem I have. People come to see us, they just don't know what's possible.
So if there's thousands of denture wearers, let's say within an hour of your practice, as you mentioned, why aren't they all doing it? Like getting their dentures secured by dental implants?
I think there's 2 main reasons. One, they don't know what's possible. They are denture wearers, so they haven't been to the dentist in a long time, other than maybe to get them realigned. Think about it. If you're wearing dentures, what are you going to the dentist for? You're probably not. But you're wearing dentures you're unhappy with, but you don't know what's possible. You don't know what's out there. And secondly, I think times have changed. I think when they used to hear about dental implants, it seemed like such a barbaric procedure before, where now, with the use of technology, it is the most painless, easy procedure we do, and people are shocked at the final result and never knew that it would be such a simple procedure and make such a huge difference in their life.
How old can you be to do it? Because it seems like they're, I guess, an older population, they may fall out.
Yeah, no, I've got people in their 80s. They've come to me and they say, listen, I like my dentures. I like the way they look. They look fine. But this lower one's flopping around. The upper one falls out. Maybe they're dating again, or maybe they're out, or maybe they're judging what they want to eat on their menu by what their dentures are going to respond to. That's a terrible way to live. And so a lot of times I get people that are well into their 80s, and they'll come to me and say, well, I've been told before I'm too old. Totally untrue. I've been told I don't have enough bone. Can I tell you, Randy? Never seen that in my practice where you don't actually have enough bone.
Is that right?
Yeah, they get told that from other people who maybe don't have as much experience.
My mother, I don't know if I told you this, 73 years old. I'm interviewing a few doctors, and I say, hey, you should consider dental implants. Her medical doctor said you're too old. She was 73.
Completely untrue. Completely untrue.
But are there patients that think the same? So
there's a lot of patients. Most of the patients think, I've been told before. They've been told by one person, and they've used that as the mantra for the rest of their life. I can't do it. Or I have osteoporosis. Well, we know that's not true anymore. The bones in your arm.
You mean it's not true that you're not a candidate?
That's correct. We've got people that have osteoporosis or on certain medications, and of course they can have dental implants, because this bone here in your mouth is very, very malleable to dental implants.
What about pain, though? It seems very painful. Now, you said one of the most painless things, but I guess you have to say virtually painless, or put, warnings, disclaimers all over the place. But pain is not something they really complain about?
Nothing.
Because it seems painful.
Yeah, nothing like before. Let me give you an example. Before, back in the day, a surgeon or whoever was doing the dental implant had to cut open the tissue. It's terrible. And had to open this tissue to see what was there. Cut open the gums, flap open that tissue, and kind of see what was there. It was more exploratory before they actually put the dental implant in. Now when you look at what we can do with CT imaging, computerized imaging, things where we can take an x-ray ahead of time. We know exactly what we're getting into. Most of the time, we don't have to even open that gum. We can go right through the tissue, place that implant. That's virtually painless.
The bone doesn't have feeling.
The bone has no nerve endings. So the bone, your pain is not from your bone area where the implant's going in. That's kind of the misnomer sometimes. Can I tell you, almost every patient we do, you know what they survive on for a day or two? A little bit of Motrin, and they're up and running.
Is that right?
It's amazing.
So what are the frequently asked questions? Okay, so a denture wearer goes into you, because you say no more dentures. What do they want to know on that consult?
Well,
like, what does that conversation go?
Right off the bat, you hit it on the head. Is this going to hurt? That's the one. It almost is like they don't even care. I don't care what it costs. I don't care where I'm going. Is this going to hurt? Fear and pain keeps most people away from the dentist. And so now we've got a situation where I can assure them, believe me, this is not going to be painful. That we don't have to put you into a deep sleep. We don't have to do all those things anymore because the pain part of it is almost non-existent. And so with the proper planning, the right technology, we can have you into these implants, 2, 4, 6, 8, whatever you need, the amount of implants to support your prosthesis.
Let's go over those options. Okay. So patient goes to you, they're a denture wearer.
Yeah.
What do you say? Like, what are their options? Let's talk about options.
First of all, I like to know, do you like the way these dentures look? I mean, I like to know, are you happy with the way your smile looks? And a lot of times they'll say, you know what, I am. I like the way these, so they're happy with the cosmetics, they're just not happy with the functionality of them.
Okay.
And so I want to make sure that when they come to see me, they aren't being sold on a product because these are not commodities. We want to be able to tell me what's bothering you and let's see if we can come to some conclusion of what's going to make you happier. So I like the way the denture looks, I just don't like the stability of it. Well, let's look at what we've got. Through a quick x-ray, we can quickly say, you know what, we've got bone here, here, and here, maybe 2, 4, 6, 8 or implants, we can support that.
So let's start with 2. Okay, so 2 implants.
Yes.
For the lower, snap in, snap out.
A denture you could snap in and snap out.
And that's a pretty good option.
And that's a great option. 2 implants, and boy, that's a service we provide all the time. And let me tell you,
would you say it's better than the best lower denture? Not supported by dental implants?
The best lower denture without implants is still a bad denture, typically. It's terrible. Most denture wearers are so unhappy.
But I know denture wearers, they never complain.
Well, they don't complain to you, but they complain to us. They complain to us. They come to see us and they go, my upper's fine. It stays suctioned in, and I can use a little of that paste. You know, unfortunately, when a lot of people are using the pastes, you know, they go and they buy the paste that they have to put on, that's a clear indication that dentures don't fit well. We shouldn't be relying on those pastes. Good dentures usually don't need the paste. If you're using a lot of paste, it's because probably things don't fit so well.
So next level up. Okay, so 2 dental implants, full arch of teeth, they could eat and chew with that.
Absolutely.
What's the next level up?
The next level up would, let's say you want a denture upper or lower, that you want to be able to snap in and snap out. Maybe you would like the upper to have no palate so you can really taste your food. That's another complaint. I wear this upper denture, I can't taste my food that well. And that bothers me. I go out to dinner, I know it's a good dinner, but I'm only getting 50% of the experience. I can't taste my food. Well, let's make you a denture that has no palate. I can do that with 4 implants and you can snap that denture in and out. And when I say snapping out, boy, Randy, when they snap that in, wow, it's as solid as a rock. It's as solid as your good-looking teeth.
Is there, so is it hard sometimes for them to pull out?
No, actually, you know what? We can actually control the amount of torque it takes to pop them in and out. So let's say you have an issue and you say, hey, you know what, Randy, I'm experiencing a little arthritis in my fingers, and that's not easy for me. I can actually put in different inserts that will dictate how much force is needed to take those in and out.
So they could touch, so 4 implants, you snap in, snap out.
Yeah, it's awesome.
No more adhesive.
Yeah. No adhesive, no. The adhesive days are over. That goop, no more buying goop. These are snap in, snap out. Now let's go to 6 implants, right? We're talking.
And you can make them look good.
Oh.
Like cosmetic.
Here's the goal. Your teeth are going to look as good as somebody that I do a cosmetic makeover on that has all their natural teeth. No one will know the difference between that person has veneers and that person has a snap-in denture. The teeth are that good.
Okay, so next level up is what? It seems like they want fixed, right?
I would love to be able to have something where I could have it in and not take it out anymore. I want it to be as if it's part of my body like I was when I was younger. And that's absolutely doable. 6 implants, we make a prosthesis that goes in and screws down. The only person that can take it out would be your dentist. We'd have to.
How do they take care of it, by the way? Because that seems like what everybody wants, right?
Yes, no, that's the great thing. You know the great thing about dental implants? I got to tell you, this is the greatest thing. There's a lot of people out there that maybe have their teeth and they say, you know, Randy, I got bad teeth. I got soft teeth. I got teeth that are just decaying, or I've had a lot of root canals that have gone bad. The greatest thing about dental implants is you don't get decay. You don't have all these periodontal or gum problems because your teeth are gone. The causative problem of those is gone. So now with implants, a lot of these people's problems that they grew up with or they're used to, they don't even exist anymore. So now it's just maintaining it.
So they can eat and chew, I mean, like vegetables, like raw vegetables?
The best story, the best stories in the world, they come back and say, I haven't had corn on the cob or a steak in 15 years. And they come back and they say, 2 days after I was done with you, I was out with my family just gnawing on a corn on the cob. That's what they're happy about. They're not even talking about how great they look when they smile. They're talking about, I can eat corn on the cob.
How soon can they eat, though?
They can, well, that's the great thing. The technology has allowed us teeth in a day. So you want to get teeth in a day, you got no teeth today, we plan your case out.
That sounds like an exaggeration.
No, literally, teeth in a day. So we plan out your case and you're ready. The day you do surgery, you're going to walk out with a new set of teeth and you're going to dinner that night. It's amazing. It's amazing.
You're eating, hopefully, soft foods.
Soft foods initially, and we're going to work you up, but by the time you're done physically, fully healing, well, you're gnawing on the roughest piece of steak.
Is this one of those things where they say, you know, I should have done this years ago?
Absolutely, absolutely. But you know what?
I'm like, what do they say? Give me an example. Like
say
a recent example.
They'll give you a perfect example. Somebody who had come to me and they had, I'm going to show you this case here. She had a lot of physical issues which tore up her teeth. The teeth were small, they were worn down, they were flat. A lot of the teeth had gone bad. You know, family history, genetics, and just issues that said my teeth went bad. And I said, okay, instead of a teeth in a day situation, we pre-planned her case. She left that day, healed up, and look at the difference in that smile. Randy, just look at the difference between what worn teeth
and that's like a denture?
Yes,
that's like a snap-in?
That is a screwed in, tightened down. Yeah, that's a fixed denture done on 6 implants. So now you have a situation
That's a pretty
here.
smile, by the way.
Yeah, but here's the crazy thing, Randy. That's a lot of teeth just on 6 implants. What we can do now, you don't have to have 1 implant for every tooth that you're missing. 6 implants gave her a full complement of teeth. This lady is eating like a champ now. It's amazing.
So they can eat whatever they want.
Oh, she's eating whatever she wants. She goes, if I would have known this was possible, I would have done it years ago. But you know what I'm glad about? The technology now allows us to do it so much more predictably. I'm actually glad you didn't do it years ago, because what we're doing for you now is so much better than even 5 to 10 years ago. It's exciting.
And you teach the topic to dentists across the country.
Yeah, that's really a rewarding thing for me. Almost every Friday.
Is there a big learning curve?
Initially,
I mean, are you better 1,000 implants later?
I think
thousands.
Conceptually, I think with anything, the more you do, the better you get. I think for us, we can do it almost in our sleep because it's just so predictable for us.
Is this the happiest group of patients? Like I know you do a lot of cosmetic cases.
Yes.
But the denture wear that you give a fixed set of teeth.
Yes. Yeah. I would say it's probably our happiest patient because you're talking about somebody who has spent a huge part of their life. My teeth out, my teeth in. I have to buy this goop. I have to fix them in. I'm embarrassed about what I can eat or what I can't eat. You know, I don't want to kiss my wife or my spouse, my significant other, because I'm self-conscious about what my teeth feel, or are they going to come out? Now you're talking about somebody who has teeth like when they were...
Like they don't have to think about their teeth anymore.
You don't want to think about your teeth. You probably woke up this morning, you probably didn't think at all about your teeth.
No.
Right, you came to work. I don't think about my teeth. I don't think about when I come to work. I think about everybody else's teeth. And when I think about this, it allows me to think about them and what they finally can look like and function like. I'm going to make them look great. That part's the easy part. It's about making their functionality,
eating, chewing, and all that stuff.
Functioning, something that they really are happy and excited.
I want to thank you for coming on the show. Great information.
Thank you so much.
Okay, so the consultations are free.
Consultations don't cost anything. All it costs you is your time. So if you're curious about what's possible, if you don't even think you can imagine what's possible, by all means.
And you or your partner, you guys have similar training?
Yes. We've trained a lot together and a lot.
You guys are buddies?
Yeah, we're together all the time. All the time. You're going to see Ritter.
And you guys even hang out on the weekends sometimes.
Yeah, we live on the same street. Or we have wives that have the same birthday. It's crazy. It's crazy. But come see Ritter and Ramsey. Come see the consult. We can tell you what's possible. We're here to help you get whatever it is you're looking for.
Thanks again.
Thanks a lot.
Great info.
Thanks.
You've been watching The Wellness Hour. I'm Randy Alvarez. We'll be right back. You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. We're talking about dental implants with us. We have an expert on the topic, Dr. Ritter. Dr. Ritter, welcome to the program.
Great to be here, Randy.
Now, we've had your enthusiastic partner on the show talking about dental implants.
That's great.
And, you know, for people that don't know you, I mean, you work together. You guys really kind of focus on, I guess, both dental implants, kind of smile makeover type stuff.
Mm-hmm. We do a little bit of everything in the practice, Randy, and we have a great partnership, great relationship. We kind of play off each other. We have a lot of fun in the practice, but we're able to provide some really great results for our patients that are life-changing events for them.
Okay, good. Now, with the denture crowd, how long have you been doing dental implants, by the way?
Oh, 15 plus years.
What's changed? I mean, why is it what, and I didn't ask your partner this, and I'll ask you, why is it what used to take you guys 9 months or 6 months for dental implants now can happen on the same day?
Yeah, well,
what's changed?
What's happened in the last...
The denture wearer could go in, after you do the pre-planning, I mean, the same day walk out with teeth.
I think a lot of it has to do with just technology. Okay. Obviously, everything around us, we're all digital now, right? Everything from your iPhone to your iPad. We have technologies now that we didn't have before. Things like cone beam CT. Now we're able to image the bone and find out where the bone is and where it's not. And so now you can go ahead, because of the types of implants that we have with the surfaces that are on them, allow them to integrate very quickly. We're able to immediately place the implant and then place some sort of a denture on top of it that's screw retained so it doesn't come out. I mean, that's a big thing for denture wearers. They're used to dentures clanging around in their mouth. It's very uncomfortable. They don't look happy. They're not happy in general because their dentures are kind of floating around there.
What do they say to you? You know, because I've mentioned this to you that, you know, of the denture wearers I know, I never hear anybody complain. I don't think I've ever
Well, you wouldn't hear them complain because they're not going to tell you. I mean, me, they're going to tell because I'm a dentist and I have
what do
an
they
understanding.
Say? Like, what are their gripes?
Doc, can you help me out? My dentures don't feel right in my mouth. I can't chew my food. I'm just not smiling because they don't really look good in my face. So I can address almost all of those things in one time with a little bit of implants, a little bit of technology, and just a little bit of understanding as well.
Of all the dentistry, because you do a lot of extreme makeovers, smile makeovers, would you say that the denture wear that you give, like teeth back, like a fixed set of teeth, is the happiest group?
Let me give you an example, Randy. How about my mother? My mother, who I basically did all of her teeth for her about 20 years ago. And for whatever reason, whether it be periodontal disease or just not great care, she is my mother, she wound up losing all of her upper teeth. Okay. So what did we do for her? We're able to go ahead and place the implants after we imaged her with the technology we talked about.
Did you have to talk her into it? They always say that the parents don't listen to their doctors.
They don't listen to their doctor. They had to listen to my partner. She listened to my partner, right? Who's like her other son. Okay. So basically she said, okay, I'm ready to move forward. So then what we're able to do is...
she had a denture.
No, she didn't have a denture. She had her own teeth.
Oh, she had her own teeth.
I restored all of her own teeth, but they all failed.
Okay.
All because of periodontal disease, and she just didn't take care of it, thinking, you know, there's another fix, there's another solution. And there was another solution now. Now, 15, 20 years ago, there probably wasn't, but now there is. So we're able to take out all of her teeth, put implants in, and secure a brand new denture without a palate, meaning there's nothing on top of the roof of your mouth, so you can actually taste food.
Like a full arch of teeth.
A full arch of teeth. You can't tell that this is a denture. You can't. And all of a sudden, she comes in one morning with teeth and leaves the same afternoon with teeth that are not coming out. You don't take them out and put them in a glass jar next to the bed. You don't take them out and leave them in the sink by the toilet. It's not what we're talking about. We're talking about holding onto your teeth, something that's solid, fixed, so that when you smile, they stay in place.
What does she think about it, by the way?
Oh, she hasn't even thought about it. I mean, to her, it's part of her. It's just teeth. It's just teeth now, which is kind of the solution we're looking for, right? We want something that's going to stay in their mouth, that looks good, that they can chew their food. Look, you know, we live in South Florida. In South Florida, we have a big retirement community, right? A lot of people come down there to retire, or they spend time both up north and down in South Florida. Well, the fact is, the people who come into my practice, I can tell you anecdotally, the ones that are more advanced in age, the ones that are in great shape, they have the majority of their teeth, or they have implants replacing teeth that they lost. Okay. I mean, it's pretty anecdotal, but I'm telling you from experience from 20 years in the practice, those are the happiest people because they've got teeth to chew with. Obviously, a smile makes a big difference for them. On the same token, you know, they're able to chew their food, chew foods that they weren't able to chew before with their dentures.
Do they tell you these stories?
Oh, well, every day.
Like food stories?
Food stories. They love to tell me that they went out to Capitol Grill or go to Fleming's and are able to actually chew a New York strip steak. That's a big difference for them. It's a big difference in their quality of lifestyle. It's a big difference in the way that they perceive themselves, who they go out to dinner with. You know, if your dentures are falling out of your mouth, you're not exactly going to go out with friends because you're afraid that they might fall into a glass jar like Mrs. Doubtfire did, right?
Okay, yeah. Now, how many denture wearers do you think
there
are in your
thousands of denture wearers.
Why aren't they all doing it, though?
I don't think they know about it.
Good.
Well, I don't think they know that that's what's available to them right now. I mean, this technology has been out for a couple of years and it's really, really good, but I don't know if the media has done as much to publicize this as they have in the past. There are thousands of people north, south, west of me. You can't go much further east from me. I basically live on the coast as it is. But I think there's an opportunity there for people to improve the quality of their lives. And believe me, I haven't had anybody who has transitioned from a denture into an implant-supported denture that hasn't said it's one of the best things they've ever done with their life.
And so what about age? I mean, what's your oldest, yours in particular?
My oldest patient that I've ever treated?
For dental implants.
Oh, for dental implants, probably in their late 80s.
Is that right?
Well, it's important.
I mean, don't you worry they're going to fall out?
What, the implants?
Yeah.
Oh, absolutely not. Fantastic studies that go back. It will integrate. You know, again, careful planning.
Integrate meaning that the bone's going to grab
the bone is going to grab around that implant. It's kind of one of these things where it goes back and forth. The bone holds the implant, but the implant actually holds the bone around it. It's kind of counterintuitive because you need one. You can't have one without the other. If you don't have a tooth there or an implant, the bone melts away, right? Which is no good. So you want to have either a tooth in there or you want to have an implant there. Either way, it holds the bone, and then in turn, the bone holds the implant or the tooth.
Okay.
So no, they last a long time. In fact, it's a kind of a restoration where if it does take, in other words, the implant does stick in the bone, and what we call integrate, which is a fancy term for sticking in the bone.
Okay.
If it stays there, it's probably the last time you'll ever have to have it done.
It's nice. Now, what about the grouping? Because with, you know, we talk about no more dentures. What about the people that their gums, they've been told their teeth have to go, but their gums are bad?
Yeah.
Can they get dental implants?
Absolutely. They're a great option for dental implants.
If they have bad gums?
Sure. Because what we're going to do is eradicate and get rid of all the bacteria that was around the teeth, right? So they've lost the bone around the tooth was moving, their breath didn't exactly smell great, they couldn't chew anything because they were afraid of a tooth popping out. So we're taking them from that environment, that scenario, putting implants in and sticking a modified denture on top of it. It's called a hybrid, from a technical term. You screw that in and it doesn't come out. And so people can go ahead and chew their food like they did when they were 20 years old and they had all of their teeth. It's a great option that we didn't have before. It allows us to give people back a quality of life. And really, at the end of the day, when you're much more advanced in age, that's what it's really all about. It's about quality of life.
And you teach other dentists. I mean, you lecture on the road teaching dentists about dental implants.
Yeah, I've been doing it for 14 years. Worked with 1 or 2 different dental implant companies.
I mean, the biggest companies in the world of dental implants hire you guys.
Yes.
To teach people about dental implants.
Yeah, we're very lucky. We're very blessed. We speak for some of the biggest dental implant companies.
Is there that much to it, though? Like when you're teaching dentists?
Yeah, I think it is a lot to it. You want to make sure that you do it well and do it right the first time, for both yourself and for the patient. You want the patient to trust and value you. You want them to have a positive experience, because at the end of the day, after they go home and they're able to chew their food again and be happy, they're going to tell their other friends who are in the same scenario that didn't know that this was possible.
Do you get that? Like, I guess denture wearers hang out with other denture wearers.
Oh, well, I don't know. I don't know if they hang out specifically with other denture wearers, but they know each other.
Okay.
They definitely know each other. They run in the same circles. They run into a friend or a relative, and they say, oh, you know, I used to have a problem with my denture, not anymore. Oh, really? What's happened to you? Well, I found Dr. Ritter and Ramsey, and there are these new opportunities that are available now where they can put the implants in, and you actually leave with the denture screwed into the implants that same day. You know what? It doesn't hurt either.
Same day.
Same day. It doesn't even hurt.
Somebody watching this, I mean, if everything works out, somebody watching this can call. What's the fastest possible turnaround time? If everything goes right. They're 75 years old, which is young in your town. They go in. What's the turnaround? A couple weeks? 3 weeks?
No, I mean, if they come in for a consultation with us, in other words, you want to sit down and just spend some time eye to eye, knee to knee, and just kind of talk about where you are, what your situation is, what you don't like. And then we say to you, well, you're a great candidate for immediate implants with some sort of what they call teeth in a day or teeth express, whatever you want to call it. After careful planning, they come in the morning, they have their implants placed, they have the denture, or whatever it's called, a hybrid, screwed into the implants. They leave that same day with their teeth. You're not walking out without teeth.
So a full arch of teeth is about 6 or 8 implants?
It can be anywhere from 4 to 6 to 8 implants. And that gives us a lot of options. You know, in our practice, we always try to give patients options. That's the key. I think it's very, very important to give somebody options. You know, sometimes we don't have options, but the majority of the time we have options. And giving them options of maybe they don't want to have a complete denture, maybe they want to have all individual teeth, or maybe they want to have a combination where you can unclick it and click it back in on top of the implants, but it still doesn't move in the mouth. There are options available that nobody knows about that we can offer now that wasn't available even 5, 7 years ago.
Okay, so now I think I'm getting an understanding, and I'm very skeptical, because it seems very painful. What's your experience with the patients?
Actually,
I mean, it's got to hurt.
No.
Pretty bad.
Actually, no. This is what's amazing. There's less discomfort having a tooth taken out and have an implant placed than there is sometimes to have a tooth filled.
Is that right?
Yeah. Well, you got to remember that the implants go into the bone, and the bone, while there are nerves around the bone, there's no nerve in the bone itself around where the implant is going. So once the patient is numb, they don't feel that at all. Remember that when we're working on a tooth versus an implant, you have a nerve inside of the tooth, and you got to make sure the tooth is really, really numb, otherwise the patient feels it. There's less discomfort after implants are placed than there can be after a set of crowns are done.
What about consultation? So if somebody's watching this, and we are out of time, and they want a consultation, there's no fee for that.
No fee for the consultation.
What does that look like? Okay, so they go in.
Well, let's start at the beginning. They go ahead, they want a consultation. You'll go ahead and call our office phone number. You'll give our office a call. You'll speak to one of our treatment coordinators there. They'll set up an appointment for you to come in. There's no charge to come in and chat. And tell me what you don't like. Tell me what you would like to see.
I hate my denture.
I hate my denture. Okay, I don't like the way it looks, I don't like the way it feels. You'll come in, we'll take a look and see what's going on in your mouth. We'll ask you a lot of questions about where you want to be at the end and give you the potential options that are available to you. That's really comes down to is find out the options. If you qualify, which just about everybody does in one way, shape, or form, then we can work with you from that point out
So
to
how
get
soon
you
do
to where
you
you
tell
want to
them
be.
they're a candidate?
Oh, relatively quickly, within the first 10 or 15 minutes.
Okay.
Yeah.
Okay.
Yeah, it's a great opportunity for them. I don't think in today's age where you have access to information and the ability to call somebody and get somewhere, it should be an opportunity for the patient to come in, find out what their options are, and move forward with treatment.
Now, one of the things, and I'm not, and people need to know it's a real interview, and I'm not on your side, I'm just asking the questions, but it doesn't cost more. Is this true? It doesn't cost more to go to an expert on dental implants. Because when people ask us for referrals, we don't give them referrals. We say go to someone with a lot of experience, go to someone with expertise. You teach the topic, you lecture nationwide. It doesn't cost more to go to experts.
No, it costs the same. It's the same
so you
thing.
might as well.
Well, you might as well come to an expert. Come to somebody that does this all the time. You see, unfortunately, some of these more advanced techniques are not taught by the average general dentist in town.
Okay.
So why not come to somebody that's been doing this for a long period of time and get an opinion that really could help you get to where you want to be. Again, you wouldn't know unless you see the show or you do some research online by using Google and do a search. Who does this most times, right? Come in, let us show you what we can do for you, and I think you'll be pleasantly surprised.
Okay, good. I want to thank you for coming on the show.
Great,
Very
Randy. Great spending time with you. Thank you very much.
And you have before and afters and information on your website.
Yep. You can go to the website or just give us office a call.
Okay, good. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, visit our website, and you could do a search for Dr. Ritter. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.